So the good news is in Las Vegas or Clark County rather, we have plenty of plans to choose from with great benefits and reasonable costs. So there's no need to worry when you're looking for a Medicare plan when you turn 65. Matter of fact, a lot of these plans are less expensive off of your group coverage than they are. So what I usually do, and I tell people, is go to Medicare.gov, which is the official U.S. government website for Medicare. And it's all zip code based driven. So based upon where you live, okay, that's a big key word, where you live most of the year. I put in a Las Vegas zip code over here, and these are all the plans. So obviously this is original Medicare. So you got to pay your Part B. Now this can change depending on your income, okay, and there is deductibles, okay. Well, the way around that is once you sign up for Part B on your Medicare, and you have A and B, now you're entitled to a Medicare Advantage plan if you choose to go this way. So here's some of the companies that are here in Clark County. Athem came back in 2019 with a couple HMOs. They had some special needs plan under the CareMore branding the last few years, but they came back with an HMO, and they've got a few different plans, and they use the Southwest Medical Associate network for the most part. Of course, Humana is one of the big guys. They have a new product. This is actually the new one this year, the new HMO, the 056. It's kind of replacing the old one that they had, and it's just, long story short, it's richer benefits. So this has been really good, and this company uses healthcare partners. Senior Care Plus is a new company here in Clark County because when clients have more to choose from, it's always a good thing. So this is a nonprofit out of Salt Lake. They're in Idaho, Utah, and Nevada. It's also an HMO, and they use the P3 network. AARP Medicare Complete is a United Healthcare company. They brand it under this name right here. It's an HMO, and they use healthcare partners. They've been here for a while now. And they also own United Healthcare Medicare Focus HMO, which is the old Senior Dimensions company. They just changed the name, and it's Southwest Medical Associates is in the network. SelectHealth Advantage Essential HMO. Again, this is the SelectHealth out of Salt Lake. And Athem, Humana Gold, these are all HMOs. Another HMO, Medicare Select, this is by Aetna, this is an HMO. They actually have a unique situation. They actually have a very large network of doctors, and in 2019, the new P3 network, you can also see those doctors under the Aetna insurance brand too. So now you even have more doctors to choose from in hospitals. So very good on that. Here's the Premier plan. This one does have a cost with the AARP Medicare Complete United Healthcare. And this is the Humana PPO. Now, Humana actually has 3 different PPOs. You have to be kind of careful because one of them actually has a national network that you have access to. The other one is a local PPO, the other 2. And they have different deductibles, so you can kind of see here. Aetna Medicare Choice Plan, this is the other PPO. Now both Aetna's PPOs, the Choice and the Select, which should be here in a second, both use a national network. Their deductibles are extremely reasonable for out-of-network costs. And again, talk to your broker about the details of every single one of these plans. Let's see, yeah, here's the Aetna PPO Select. So we've got a lot of choices, you can see. This is not the case in most counties in the United States. I mean, Clark County, Nevada is probably a Tier 1 Medicare Advantage territory for insurance companies because we have a lot of seniors here that retire. The networks are pretty strong. And so for that, you get extremely tight benefits, and all these companies are after your business. So again, you know, this is just an overview of what's available in Clark County for 2019. As always, use a broker. The broker is supposed to look out for your interests, and they don't work for an insurance company, and they should guide you in the right direction. But before you get to any of this, you should always talk to your broker about who your doctors are and why do you want to keep them, if you want to keep them, because it's really important to try to keep that doctor-patient relationship, I think at least. And if not, it doesn't really matter. But if it does, start with there and then talk to your broker about your medication, because there are plans in Clark County through a lot of these companies that are called special needs programs, and those allow you to have lower cost medications for the most part and out-of-pocket costs based upon your health needs. So let your broker know what's going on with the health situation as far as your medications, because we're not allowed to ask, but if you bring it up, we might be able to show you a better plan that could fit your needs at least. So if you have any questions, you can always give my office a call, or at least I can always point you in the right direction. Thanks for your time today, folks. Bye-bye now.